Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. All right. I am excited. I have some great news. It is some wonderful news. Body in Balance is now going to be streaming on the church family channel that is headed up by Brother Steve. Man, I am so excited to have partnered with Brother Steve on that. And it's a setup so that there is a section called Church Medicine on the Church Family channel, headed by Brother Steve. He's a wonderful brother that I've known for years, and I met his parents. His parents are some wonderful people. When I was in Ohio Northwest, I was a Sunday school superintendent for that jurisdiction. Shout out to Ohio Northwest. Woo! All right. So I thank God for Bishop Kimbrough for giving me the opportunity to be there. And so I want to let you know that if you have a Roku, if you have a Fire Stick, if you have Apple TV, you can find the Church Family Channel app. And when you go into the Church Family Channel app, if you get onto the Church Medicine channel or section in there, you will be able to find Body in Balance. Yes, Body in Balance. So now we're streaming. I just thank God. Won't he do it? I thank God for the opportunity to be able to share the knowledge that God has blessed me with in the area of medicine. So we are in season 3. Season 3 just started out this year in January the 1st. And look at God. We are already having subscribers. We are having thousands of viewers. And it's just wonderful. I'm excited about it. And I hope that this is information that is being helpful for you. So what your doctors don't tell you, I'm going to try to fill in some information. It's not that they don't want to tell you. It's just the time isn't there sometimes to get everything in. So we're going to be getting some things in on season 3. We're talking about the ear. And this week, season 3, episode 3 is understanding hearing test. To understand the hearing test, the answer to I can't hear you. I can't hear you. Another announcement I want to make is that we will be having a special guest. And what I believe we're going to do is have we're going to work on doing a live set with an audiologist who's going to come on board and give greater information into the area of hearing. I am an otolaryngology PA, and so I help with the ear. However, this friend of mine who is an audiologist and owns her own audiology practices, she's got 5 different practices in or your offices to her practice in Atlanta, Georgia. I'm so proud of her. And she's going to be coming on and giving us some great information about how she does the hearing test, how she tests children. And we probably will be able to, if we're going to be live, talking about, getting some questions answered and everything. So let's jump right into this. Understanding the hearing test. Some of this we're going to be reviewing from the last week. The last 2 weeks, we'll get some information from the first episode, which is the anatomy of the ear. So here's our agenda points. How hearing works. We're going to talk about understanding the audiograms, so you'll understand how we read these. We read audiograms the way a cardiologist reads an EKG. And we can look at that piece of paper after you've had your test and tell the things that are going on and where they're happening and what's going on with your ear from that test. What the tympanogram means. We're going to talk about what that tympanogram means. An all-inclusive audiogram will include a tympanogram. And that talks and gives us some information about your middle ear. And how to maintain your health, your ear health and hearing. Okay, so let's talk about the anatomy. Quickly, we're going to just be reviewing. We're going to be talking about the outer ear. Those little flaps that God stuck on the side of our head might have been his way of having some comedy for some of us. And those flaps tend to funnel sound waves through that tunnel. You see the ear canal, through that tunnel, and it hits a eardrum that is deep inside the ear. That eardrum looks and is tight and taut like a tambourine. And so when the sound waves hit it, just like those little things on the tambourine jingle start to vibrate, so do the bones in the middle ear. The 3 bones in the middle ear is called the malleus, the incus, and the stapes. The malleus, the incus, and the stapes. Those 3 bones are in the middle ear to continue the mechanical energy of vibration into the inner ear, which is the cochlea. The inner ear being the cochlea. The cochlea is made up of fluid on that snail-looking area, and then where you see those loops that look like orbits, those loops are called canals, semicircular canals. So those inside that snail is fluid, and there's a lot of teeny little nerves called hair cells. Those hair cells transmit that vibration, which goes from mechanical vibration to electrical impulse vibration, and it stimulates the acoustic and vestibular nerve. The acoustic and the vestibular nerve, which runs to the temporal area of the brain. Okay? So we'll quickly go over that. The outer ear, there's the ear canal, there's the eardrum, the 3 bones, which are the malleus, incus, and stapes. Up to that area, if you have any problems in any one of those areas, then you can have what's called conductive hearing loss. If you don't have any problems with that area, but you're still having problems hearing, then usually there's something going on with the inner ear. There's damage to those hair cells. If there's damage to those hair cells, then you have a problem called sensory neural hearing loss. Now, if you happen to have fluid in the middle ear, or there's a weird kind of growth called a cholesteatoma that could occur, which hinders the movement of those bones, and there is nerve loss, you can also have sensory neural, and conductive, which is called mixed hearing loss. We'll talk about all that further in our discussion. So, outer ear structures, we talked about them. The pinna is the visible part of the ear that collects sound waves and puts them through the tunnel. The ear canal, which carries and holds a lot of wax. And if there's wax there, that will hinder those sound waves. That can make you have some conductive hearing loss. Moving on, malleus, incus, stapes. There's the eardrum, that fuchsia-looking object, and then you have the tan-colored 3 bones. Those are ossicles, called ossicles. Those 3 teeny bones amplify the vibrating sounds. Sound amplification is transmitted through those bones after the eardrum is hit. And then you can also have what's called the eustachian tube. Let me go back. We're going to go back 1 slide or 2 slides, and you'll see this area here saying eustachian tube comes off. That leads inside the head, and there's an opening in the back of the nose, behind the sinus area, behind the middle, the turbinates, or those 3 shelf-looking bones inside the nose, in that throat area, nose throat area. That's where the eustachian tube is. That's what makes it hard for you to have, like, you'll have fullness, you'll feel like you're on an airplane. So that's what the eustachian tube gives, a equalizing the pressure between the middle ear and the rest of the atmosphere. That helps with your hearing. So when you're on an airplane and you feel like your ears need to pop, that's because of the eustachian tube. Now, the structure called the cochlea. The cochlea is a spiral-looking, snail-shaped organ that plays a crucial role, a very crucial role in your hearing for sound vibrations into electrical signal. We talked about all of this. We talked about how the sound vibrations are transformed and they go as an electrical signal into the brain. And when it gets to the brain, it's to the temporal lobe, which is on the sides of your brain. The temporal lobe is on the sides of your brain. All right. So if you have hearing loss, if you have certain types of hearing loss, now there's a reason why little kids get tubes and grandma and grandpa usually get a hearing aid. Well, little kids usually have conductive hearing loss. That is not to say that children can't have conductive hearing loss, because you can have some congenital problems that cause you to have hearing loss that could be conductive. And that's where those 3 bones are not connecting very well. And so if they don't connect, and there's no, when it's vibrating and they're shaking, if there's no connection there, then there's no hearing. The hearing is off. So that has to be fixed. And that would be a form of conductive hearing loss when sound is not conducted sufficiently through from the outer ear to the eardrum. This requires some type of medical attention. Now, if there is fluid in that middle ear, that can cause those little bones not to move so well, especially if it's very thick, snotty looking fluid. So what do? We make an incision. We'll talk about that later. But those 3 objects that you see, those are tubes. The small white one and the shorter one at B, both of those are smaller tubes that are not temporary, and they don't last as long. They will last in the ear anywhere from 12 to 18 months, sometimes up to 24 months. If they don't come out within 24 months, sometimes we'll let them sit for 2.5 years, and then they have to go in and take them out, because sometimes they start causing more infection because they get infected and the body starts rejecting them. So you'll have to take them out. They fall out on their own out of the eardrum. When they fall out of the eardrum closes back up and you're back to normal. What they do is tend to keep the middle ear dry. While on most little children, the eustachian tubes are flat like this. And as their head grows, then their tubes start to angle. So they drain more properly than they would if the tube was not there. So it's until the child, like if they're 3 years old, 4 years old, and they're not draining properly, then we have to put those tubes in because they keep getting sick. Sometimes it could be from adenoid tissue. We'll talk about all that stuff later in another episode on just specifically conductive hearing loss. The next thing we have is sensory neural hearing loss. So not to say that grandma and grandpa can't have tubes if they end up getting middle ear infections. And so they could end up having to get a tube put in. They get a really bad cold. Sometimes a lot of people that were getting COVID were getting a lot of fluid in the middle ear. And when they would get fluid in the middle ear and it just wouldn't drain or wouldn't come out, then with antibiotics or other types of medications, then we would end up having to put tubes in. So if it's not that, and there's a problem after those 3 bones into that cochlea or on the nerve, at that point, we have to use a hearing aid. So mixed hearing loss, we talked about that. It's because they will have a combination of both the conductive and the sensory neural hearing loss. So we have hearing tests that we do. It's important to make an assessment because we need to know what type of hearing loss it is. Now, looking at this hearing test, unless you are an audiologist or an otolaryngologist or you work as an ENT, you would know that this is a hearing test, the first test that you see. Every time you see a hearing test, all circles on the hearing test are the right ear. I'll say that again. All circles on a hearing test are right ear. All X's on a hearing test are the left ear. On your hearing test, an original hearing test will be red for right, blue for left. Red for right, blue for left. When you look at a hearing aid, there'll be a red dot on there. That one goes in the right ear. And a blue dot on there goes in the left ear. Universally, whether you're in Europe, South Africa, El Salvador, Nicaragua, China, or the United States of America, red is for right ear. And the X or blue is for the left ear. We do that because everybody doesn't have a color printer. So if you don't have a color printer, you're going to see black circles and a black X. You still know your left from right ear because we all know now the circle is the right ear, the X is the left ear. Now, if you are a trained eye audiologist, trained eye otolaryngologist, or ENT provider, you know that this test shows us that's conductive hearing loss. Well, how do you know that? Well, I am so glad you asked. You all in Body and Balance audience are so astute to ask questions like that. Well, the half triangles that you see above the red indicates the bone. That indicates the bone. The half squares above the blue X's indicates the bone. That is left ear bone conduction in the half squares, and the half triangles is right ear bone connection. Now, when you see the half squares away from the X's, that means there's some conductive hearing loss going on in that left ear. When you see the half squares so close to the line and to the air conduction or the circles, which that's indicating, you know that that's just nerve loss. Now, it's difficult to find out what's going on really. That looks like there is some mild hearing loss, possibly some, well, moderate to severe. So you look at where it's at, because on the right-hand side, the left-hand side of that chart is usually some numbers that gives you the decibel reading. And the frequency is on the top or at the bottom. So the left side indicates decibel. The top or the bottom on a hearing test there will let you know the frequency. So audiograms are graphic representations of hearing ability, showing the type and severity of the hearing loss. That left ear looks like it's moderate to severe. The importance of a hearing test, I've already explained to you, lets us know whether it's conductive hearing loss, sensory neural hearing loss, or if you have mixed hearing loss. Now, the types of hearing tests that we do, it varies, and we have the hearing test where you go into the booth. You have the tympanogram. The tympanogram tells what's going on in that middle ear. Is there fluid? The first one you see, type A, means that's a normal middle ear and the eardrum moves correctly. The middle one is a type B. That lets me know that there's two things that could be going on with that. And type C means there's negative pressure, so that eustachian tube isn't working as well as it should. It may be obstructed or blocked from inflammation from inside the nose, and that could be causing that negative pressure. Now, I said, let's go back to the type B tympanogram. If it's flat, and we're going to go back to this slide so you can understand what I'm talking about. If it is type B and there's fluid, there's a number called an external canal volume. So you actually have that tympanogram which seals off the opening to the ear canal. And you measure from the sealed off ear canal to the eardrum. If that number is less than 1.5, if it's 1.5 or below, that means, and you have a type B, that means there's fluid in the middle ear. If you get a type B, but it's greater than 1.5, like say it's 2.9 or it's 3.2 or it's 5, then either the person has a perforated eardrum, meaning the eardrum ruptured, or they stuck something in there and popped their eardrum, or fluid from an infection ruptured the eardrum, or they've had surgery and tubes have been put in the ear. Now, you're not just measuring a sealed off ear canal to the eardrum, you're measuring this sealed off area and all this open space back here. So how big that ECV is tells me whether you have a hole or not. All right. So, I could have moved on this way. But anyway, we're going to talk about the myringotomy very quickly because I don't want to hold you all too long. But if you have fluid in the middle ear, this is what we do to children. They have to be sedated. Now, they are doing it. It's a technique called the hummingbird, where they can put ear tubes in without sedating the child. They put them in a papoose, wrap them up, and they're held down while they take that little hummingbird. It's a little machine. It goes to the eardrum they're using a microscope. It goes to the eardrum, makes a little puncture, and puts the tube in at the same time. If you don't do it that way, which I don't know whether I would necessarily do that with my child. The children that get it done are 6 and above. But if they're 6 and above, now it's not that it hurts, because they do not sedate them, but it is a numbing agent that goes in when the little machine touches the ear drum. There's numbing, and then it just shoots the tube right into the eardrum to take the fluid out of the middle ear, and immediately they can hear better. So if you don't do it that way, it takes about 20 minutes. They're sedated, not intubated. Sedated, not intubated. And there's a incision made in the eardrum. A suction is used to pull out the fluid, and then the tube is fit into the eardrum, which lasts anywhere from 12 to 24 months. And it falls out on its own, makes its way out of the ear canal, and either lands on the pillow, lands on the floor, lands in the sheet, wherever it goes. If it's still sitting there in a little ball of wax, then when your child comes in for an exam, we just reach in with some little clippers, little clamp, and just grab it out. Now, other devices for improving your quality of living are hearing aids, which fit in the ear. There's different models. This is the older one that fits behind the ear with the larger connection. They have smaller connections. They have some that fit directly in the ear. And there are other devices that can be used. When our audiologist comes on, we'll have her talk more about that. But hearing devices like hearing aids do improve quality of life. I want to tell you that they are selling a lot of hearing devices over the counter, and you can see them online. They're advertised on TV. Some of those are good if you have mild to moderate hearing loss. If you have moderate to severe hearing loss, they're not going to be helpful. So don't waste your money on the $300 hearing aid. If you have some mild hearing loss, then it's possible that those will work. If you have distorted hearing, they're not going to help you. So amplification is just the hearing aid makes sound louder for you to hear better. What do we want to do? Well, when they offer you hearing protection at your job, I know a lot of people, you see this when people are bringing in the Air Force guys that are working on the airline, when they're directing the airplanes, they take their hearing aid, and not hearing aid, but their hearing device, and put one behind their head and put one on. Well, you're only setting yourself up for failure, because anything over 85 decibels, and you do that every day for years, you are damaging the hair cells in the cochlea, and you're going to have that constant buzzing and ringing in your ear. I know you want to talk about it right now, but we're not, because it's a long thing, and we're going to have a whole episode on tinnitus. Okay. If you are a musician and you have things that you can put in your ear to play, put them in, because drummers, trumpet players, horn players, guitar players, you're going to have, and sound guys, you're going to have a lot of problems when you get older because it's over 85 decibels that you're hearing that noise, and it damages the hair cells in the cochlea. You cannot repair that. You cannot. So those little yellow things that you see right there, those are so helpful for protecting your hearing. The sponge ones, the little sponge ones that you squeeze and twist and put into the ear and then they expand, they say anywhere from 45 to 55 decibels of noise cancellation. That's what you want to do. That's maintaining your ear hygiene, or not your ear hygiene, but protection. Maintaining your ear hygiene, you want to use some stuff called Debrox, or you can use peroxide. If you have very, very oily skin, using 2 or 3 drops of peroxide in your ear once or twice a week will help the maintenance for getting wax out. If you have very dried skin, peroxide's not the best thing. I would use Debrox. And if you use Debrox 1 to 2 drops once or twice a week, that will be helpful in keeping the skin healthy so that your ear can clean itself regularly. If you have problems with wax, see your ENT, because you can't clean your ear out. You can't see what you're doing. You're cleaning your ear like Stevie Wonder. So quit doing that. You come and see us. We will be happy to take a microscope or an otoscope, look in your ear and suction the fluid out of there. The wax out of there, the debris out of there. We have no problems with doing that. But you are not helping yourself trying to get that out by yourself. Now you can flush it with water, but be careful with that also, because you'll get dizzy. Now, here we are. We're in conclusion. The conclusion of the whole matter is auditory health is important. Maintaining good auditory health is crucial for your well-being, because you don't know when things are coming up. You don't know when things are walking behind you. You don't know where sounds are coming from. If you're very, very young, like in your 40s, and you were blasting your ears out with Walkman, I know some of you people don't even know what a Walkman is, but with your earbuds that you have in your ear and they're just blowing you out, you can hear them across the room and you got them stuck in your head. I'm telling you, with all that bass going on, you're damaging hair cells. And by the time you get 40, if you don't have any insurance, you're going to have problems, because your boss is going to be telling you what to do or asking you to get something done, and you don't hear them and they think you're ignoring them. So you need to watch out about that kind of stuff. We talked about the anatomy of the ear ad nauseum. Both see episode 1 and episode 3. Go back and look. You're welcome to come to Body and Balance 25 on YouTube channel. Even watch it on the family channel. You can stream it and go back and learn the anatomy of the ear. Common hearing issues. You've got middle ear problems, which is infection, or you can have growths called cholesteatomas that could grow in there, or you can have something wrong with those bones. All of that is conductive hearing loss. Then you got sensory neural hearing loss. That's damage to the hair cells, damage to the cochlea, damage to the acoustic nerve. Preventive measures, you want to use hearing protection. If your job has offered you hearing protection, use it. So I've given you conclusion. We've been on here for a good 30 minutes. I want you to go back, look over the things that we've talked about. There's some great things here. And I want you to be a part of Body in Balance, learning about the ear. We're going to have a special, I'll put out a flyer on Facebook and YouTube and some of my other mediums, so that you can be a part of the live that we have with our audiologists. Let's just, until now, enjoy what we've heard, go back and learn. And I'm excited. Tell other people, get them subscribed so that you can get notices when Body and Balance is on. Hopefully, your horizons have been enlightening.